All right, we're back here with our panel this week. It's our digital exclusive. Thanks so much for joining us wherever you're watching us right now. State Senator Lisa Standridge out of Norman, Megan Mueller, the president of the Homeless Alliance, and the editor of the Journal Record, Heather Warlick, all with us here today. Thanks so much. Megan, you were talking about the Key to Home program, which you said really has been a big success. There's been some good metrics with that. Describe to me exactly what the Key to Home program is and why it's working and why this could be something that maybe more people should be excited about.
Yeah, Key to Home is what we call our collaborative approach to ending homelessness in Oklahoma City, and kind of the main initiative under the Key to Home program is the Encampment Rehousing Initiative. And what this is we're literally sending outreach workers and case managers directly into homeless encampments, and we're offering the people who live in those encampments housing. So far, this initiative has housed 444 individuals from 26 encampments. Those encampments have been permanently closed and cleaned up, and 93% of people who are offered housing from those encampments take it. So the vast majority of people who are living outdoors, when offered the resource, are ecstatic to take it.
That is interesting because you often hear a lot of times, and people have said that, you know, these people are offered help all the time and they're refusing. They don't want the help. But Senator, I'm sure you've heard that, and there are people who definitely don't want the help. But 93% is a big number.
Yeah, I mean, that's what our data tells us.
So how who's paying for these homes?
So the housing is subsidized through different blended funding. So that's something that's really unique about the Key to Home initiative is it's a public-private partnership. So it's blending public dollars with private dollars.
Okay.
So the subsidies look differently depending on the needs of the individual.
Okay, that's interesting. Senator, I know in Norman we have here at KOCL we've covered so much the fight over where shelters should be, where they would like to be, should it be open, should it be closed. It's been a big issue in your community.
It has. Well, it is a big issue because it impacts anybody that comes to Norman. You can see it anywhere, and of course we want to get these people the help that they need, but it is hurting the safety of our citizens. So we have to address that. And our churches, I challenge you to find a more generous community than Norman, Oklahoma, because there are churches, people, volunteers ready to help, people that need mental assistance, people that are addicted. The Virtue Center is in Norman. They are doing amazing things and turning lives around. So the resources are there. We just need to make sure that the people that want it receive it.
Well, the resources when it comes from nonprofits and churches, but even the nonprofits, I believe in Norman, Heather will say that they don't have the resources that they need.
The fact is that Norman and many other towns have few, if any, resources. I know that Yukon doesn't have a single homeless shelter, and they have very, very few resources for people experiencing homelessness there. And then there's a few things that we need to remember. Homelessness is not just those that were counted during the point in time count. We have hundreds more families who are experiencing what they call doubling up, or more, descriptive is couch surfing or couch hopping.
Right.
The point in time count only just, captures a glimpse of the people that are experiencing homelessness. A better count might be the McKinney-Vento numbers, which are not widely distributed, and they're actually very hard to get. Sometimes you have to file a request for them. So there's a much deeper problem here, and I think that there's a misconception that people experiencing homelessness bring with them an unsafe element, a criminal element. But I think the fact is that it's not an unsafe element that's insulting residents. It's their conscience that are insulting them. They don't want to see this on the street. They don't want to see what's happening.
I disagree. If Andrews Park in Norman, Oklahoma was a business, OSHA would be there in 15 seconds and shut them down and fine them. It's littered with drug paraphernalia, you name it. It's so bad that they're going to have to doze down the bathrooms there. It is a horrible situation. You don't want to take your child down there. If they were to step on a needle, you can just guess the disease.
Sure.
It is real, And it's not about, look, I don't want to see this. It's about it's impacting the resources that the taxpayers are paying for. So, this is a great conversation, and we've got a lot of ideas, and I think that, we've got the smart people in the room, we can figure it out. But it's a multi-layered problem that it does not going to have a wham fix. It's a lot of answers, and so I think Operation Safe is a good way to start looking and seeing how effective these programs are.
Well, it's certainly starting the conversation continue. I'm sorry.
Right. Well, I mean, I would just argue that that again, it's treating the symptom of the problem. If these people are suffering from drug addiction or mental health problems, they are going to need services for that, and incarceration only adds insult to injury in that case.
I hope they take the hand up then, because they've got a choice. It's my prayer that they take the hand
But
up.
it doesn't sound like they're arresting anybody, at least in Tulsa.
I think they're issuing misdemeanors, and so if they come back and they're still there, then they can.
And again, from the nonprofit perspective, a provider who's doing this work day in and day out, the need so far outweighs the resource that we have to address the problem. Our shelter capacity on the night of point in time for 2025 was over 100%. The shelters are full. Heather mentioned in the previous segment a 700 bed discrepancy. So again, it's an impossible choice that we're giving people, and my fear is that in the process we're creating additional